When I found out that there wasn't anything I could do but have the amputation, that was really tough. I was facing giving up everything that I loved. Once I had the leg removed, it was real traumatic, especially when I went to learn how to walk, and get around and pick myself up, only using the one leg. I thought, how? Nobody should have to go through this. When I found out then that I had to have the other leg amputated, I didn't think I could do it. I was very sad, thinking that my life was pretty much over because I just couldn't bear the thought of not having either one of my legs. So getting through that was the hardest thing I ever did. I didn't think I was going to be able to live because I just couldn't bear the thought of not having either one of my legs.
I'm Mehdi Shishabur. I'm the president of the Harrington Heart and Vascular Institute at University Hospitals here in Cleveland, Ohio. Well, we know that patients with CLTI, patients with critical limb ischemia or significant vascular disease that have ulcers and gangrene are on the rise. Many of them, over 70-80% have diabetes. Many of them have chronic kidney disease. Many of them are former smokers. And many of them may have prior amputations, meaning that they have already lost one leg and now they're coming with the other leg in trouble. It's probably around 10 to 15% of patients with CLTI are told they have no options and they end up either getting amputated or they end up actually dying because they go to palliative care.
All of a sudden, I heard these doors open and it was Dr. Shishabur, and he says, I think I have something that might work for you. That's when I was presented with LimFlow. And I can remember being in the procedure room, and all of a sudden I heard people clapping their hands and screaming. And then Dr. Shishabur's nurse came to my side and she said, Cindy, he got it done. That was it. I was going to have my leg. It's just incredible. I'm so appreciative.
These patients who have no option really have no named arteries in their foot at all. So their vascular disease has gotten to the point where it's completely destroyed and blocked off all of the arteries that we might be able to bypass to or to do an angioplasty or stent into in the foot. And the only way really to get that blood flow there in these situations is to take the oxygenated blood from an artery, divert it into the vein, and have those veins serve as a circuit in the foot to deliver oxygenated blood to the tissues. And the LimFlow procedure has allowed us to be able to do that.
We've made great progress towards demonstrating the safety and efficacy of our therapy in our first target indication, the no-option patient population. We're tremendously excited about how far we've come, and you can be sure we're just getting started.